This is part 3 of our series of videos on the adrenoceptor activating and other sympathomimetic drugs. And in this video, we are going to focus on the α-Adrenergic receptor agonist. By the end of this lecture, you should be able to discuss the selective alpha agonist in terms of its mechanism of action, pharmacological effects, as well as clinical uses. In the last video, we talked about the non-selective agents, which also happen to occur naturally in our bodies. But then scientists started working with these chemicals, and they actually created selective adrenergic agonists. So let us quickly discuss the most commonly used drugs in this group, and we'll start off with the alpha-adrenergic agonist. First, let us start with drugs that are primarily alpha-1 selective, and best examples of this would be Oxymetazoline as well as phenylephrine. Phenylephrine is a selective alpha-1 agonist. Its pharmacological use is attributed to the vasoconstriction it causes in our blood vessels, and because of this phase of constriction, you will see an increase in systemic vascular resistance, and as a result, the consequent increase in systemic blood pressure. Phenylephrine has several clinical uses. It is given as a nasal spray to act as a decongestant to reduce the discomfort of common cold or hay fever. It is given systemically for the treatment of vascular failure in shock or shock-like states, as well as drug-induced hypotension or hypersensitivity reaction. It is also employed as a vasoconstrictor in local analgesia, and it is also used as a mydriatic agent. Nasal congestion is a respiratory condition that occurs due to internal inflammation. Also termed as staphylos, this condition can be very annoying and disturbs the entire breathing process through the nose. People suffering from nasal congestion complain of a feeling that makes them think that too much of mucus is present in the nasal passage, but the truth is that the clogged feeling is a result of inflamed blood vessels in the sinuses, and this inflammation can get triggered due to flu, allergy conditions, sinus infection, or even the common cold. Phenylephrine would then target the alpha-1 adrenergic receptors in the arterioles, specifically the blood vessels surrounding the nasal sinuses. Consequently, the activation of this alpha-1 adrenergic receptor will result in vasoconstriction of the arterioles, thereby decreasing edema and increasing the drainage of the sinus cavities. Phenylephrine is also given systemically for maintenance of blood pressure or for the management of vascular failure in shock, shock-like states, and drug-induced hypotension or hypersensitivity or anaphylactic reaction. Shock is a clinical expression of circulatory failure that results in inadequate cellular oxygen utilization. Characteristics of shock includes systolic arterial pressure that is less than 90 mm or the mean arterial pressure is less than 70 mm with associated tachycardia. There are other clinical signs of tissue hypoperfusion as well, which are apparent in the sense that you would see cold and clammy skin, low urine output of less than 0.5 mL per kilogram of body weight per hour, as well as altered mental state, which typically includes obtundation, disorientation, and confusion. Shock results from 4 potential and not necessarily exclusive pathophysiological mechanisms. First is hypovolemia, and this would be due to internal or external fluid loss. Second is cardiogenic factors, for instance, acute myocardial infarction, end-stage cardiomyopathy, advanced valvular heart disease, as well as cardiac arrhythmia. The third pathophysiological mechanism is obstruction, for instance due to pulmonary embolism, cardiac tamponade, or tension pneumothorax. And last but not least, the other pathophysiological mechanism that could lead to shock is distributive factors, for instance due to severe sepsis or anaphylaxis from the release of inflammatory mediators. The first three mechanisms are characterized by low cardiac output and hence inadequate oxygen transport. In distributive shock, the main deficit lies in the periphery, with decreased systemic vascular resistance and altered oxygen extraction. And typically in such cases, cardiac output is high, although it may be low as a result of associated myocardial depression. Patients with acute circulatory failure often have a combination of these mechanisms. For example, a patient with distributive shock from severe pancreatitis, anaphylaxis, or sepsis may also have hypovolemia and cardiogenic shock from myocardial depression. If hypotension is severe in shock syndrome, the use of vasopressors is indicated. Adrenergic agonists are the first-line vasopressors because of their rapid onset of action, high potency, and short half-life, which allows easy dose adjustment. And of course, phenylephrine is one of the adrenergic agonists that is used to maintain blood pressure in shock. And as you know, phenylephrine targets the alpha-1 receptors in the blood vessels. Consequently, the activation of alpha-1 receptors causes vasoconstriction, thereby increasing vascular resistance and consequently increasing blood pressure. Phenylephrine is also employed as a vasoconstrictor in local analgesia or local anesthetics. Vasoconstrictor are drugs or chemical agents that constrict blood vessels, thereby control tissue perfusion. They are added to local anesthetic solutions to oppose the vasodilatation actions of local anesthetics. Basically, all injectable local anesthetics possess some degree of vasodilating activity. After local anesthetics injection into tissue, blood vessels dilate in the area, resulting in an increased blood flow to the site, and this increase in perfusion leads to several effects. There would be an increase in the rate of absorption of the local anesthetic agent into the cardiovascular system, which in turn removes it from the injection site, thereby causing an increased plasma level of the local anesthetic, which consequently increase the risk of local anesthetic toxicity. Additionally, it causes a decrease in the duration of action as well as depth of anesthesia because it diffuses away from the injection sites more rapidly. The addition of a vasoconstrictor to local anesthetic may have several beneficial effects. By constricting blood vessels, phenylephrine decreases blood flow to the site of injection, thus decreasing perfusion into systemic circulation. Thereby, this would increase the duration as well as quality of anesthesia. It would also result in the reduction of the minimum concentration of anesthetic needed for nerve block, as well as to decrease the risk of local anesthetic toxicity. Aside from those mentioned earlier, phenylephrine is also used as a mydriatic agent. Phenylephrine is used to assist ophthalmoscopy examination of the eye by dilating the pupils. Pupil dilation is controlled by the iris radial muscle through sympathetic innervation from postganglionic nerve fibers. Phenylephrine would result in the activation of the alpha-1 receptors, thus causing contraction of radial muscle of iris and consequently mydriasis, or what you know as pupil dilation. The second example of selective alpha-1 agonist would be methoxamine. It is available for parenteral use, but clinical applications are rare and limited to hypotensive states. Methoxamine is indicated for prevention and treatment of acute hypotensive state occurring with spinal anesthesia. It is also indicated as adjunctive treatment of hypotension due to hemorrhage reactions to certain medications, surgical complications, and shock associated with brain damage due to trauma or tumor. Methoxamine acts through peripheral vasoconstriction by acting as a pure alpha-1 receptor agonist, thus increasing total peripheral resistance and ultimately increasing systemic blood pressure, both systolic and diastolic. The third example of selective alpha-1 agonist is Midodrine. The primary indication for Midodrine is the treatment of orthostatic hypotension, or also known as postural hypotension. Basically, this is a condition of low blood pressure that happens when you stand up from sitting or lying down suddenly. And typically, this is due to impaired autonomic nervous system function. So Midodrine is actually a prodrug. It would then be enzymatically hydrolyzed to desglymidodrine, which is a selective alpha-1 receptor agonist. It exerts its action via activation of the alpha-1 receptors on the arteriolar and venous vasculature, producing vasoconstriction. The decrease in diameter would then increase total peripheral resistance and consequently resulting in elevation of blood pressure. So that's the mechanism of action of Midodrine. Last but not least, we also have Oxymetazoline, another selective alpha-1 receptor agonist. Oxymetazoline is indicated for the management of nasal congestion. So it is a nasal decongestant, usually given in the form of nasal drops or nasal spray. Oxymetazoline is a direct-acting sympathomimetic amine, of course, and it is an agonist, selective alpha-1 receptor agonist. So it acts on alpha-1 receptor in the arterioles of the nasal mucosa. Consequently, this would result in the production of constriction, thereby resulting in decreased blood flow and decreased nasal congestion. So basically, it allows or it increases drainage of the sinus cavities. So in summary, for the past few minutes, we have looked at 4 different examples of selective alpha-1 receptor agonists, namely phenylephrine, methoxamine, midodrine, as well as oxymetazoline. There are 3 main clinical uses associated with the use of alpha agonists, or specifically alpha-1 receptor agonists, namely to induce brief periods of pupil dilation or mydriasis to assist in the fundoscopic examination of the eye. It is also used, or rather they are also used in the management of hypotension, whether associated with shock syndrome or drug-induced or even postural hypotension that might be a result of autonomic nervous system impairment. Additionally, Alpha-1 receptor agonists such as Oxymetazoline and Phenylephrine are commonly used to relieve nasal congestion, whereupon they work as vasoconstrictor to allow better drainage of your nasal cavities. Alpha-1 agonists can cause headache, reflex bradycardia, excitability, and restlessness. And because alpha-1 agonists produce systemic vasoconstriction, which then result in an increase in blood pressure, the work of the heart would increase. So basically, it would need to pump even harder due to the increase in blood pressure. If the coronary circulation is impaired, for instance in patients with already existing coronary artery disease, the decrease in myocardial oxygen supply to demand ratio can precipitate anginal attack. Additionally, preparations used as nasal decongestant can cause a rebound effect or basically increased congestion after a couple of days of use. So these are some of the common side effects or adverse effects that are associated with the use of selective alpha-1 agonists. Let us move on to the selective alpha-2 receptor agonists. So alpha-2 selective agonists have an important ability to decrease blood pressure via its action in the central nervous system. Such drugs, for instance Clonidine, methyldopa, guanfacine as well as guanabans, are useful in the treatment of hypertension. The most important example of selective alpha-2 agonist that is used currently is Clonidine. The main clinical use for Clonidine is in the management of essential hypertension. Other uses for Clonidine include management of vasomotor symptoms associated with menopause, rapid detoxification in the management of opiate withdrawal, treatment of alcohol withdrawal use in conjunction with benzodiazepines, as well as management of nicotine dependence. And why it is useful in the management of all of this condition is due to the fact that it decreases central nervous system sympathetic outflow. Clonidine is a centrally acting α-Adrenergic agonist, so it crosses the blood-brain barrier, stimulating α2 receptors in the brainstem. And this action would result in reduced sympathetic outflow from the central nervous system, and this then produces a decrease in total peripheral resistance, reduced heart rate and contractility, thereby reducing stroke volume, and it also reduces renin release from the juxtaglomerular cells of the kidney. Consequently, all of these effects altogether would result in reduced blood pressure. Side effects of centrally acting alpha-2 agonists include sedation, dry mouth and nasal mucosa because of the increased in vagal activity, bradycardia, orthostatic hypotension, and impotence. Constipation, nausea, and gastric upset are also associated with the sympatholytic effects of these drugs. Sudden discontinuation of Clonidine can lead to rebound hypertension, which results from excessive sympathetic activity. So there are two main uses of Clonidine, namely as antihypertensive or to reduce blood pressure, and this is due to the fact that it reduces sympathetic nervous system outflow from the central nervous system. Additionally, Clonidine is also used in drug withdrawal management, and this is due to the fact that it targets the adrenergic hyperactivity, which might be the basis of narcotic and alcohol withdrawal syndrome. So it works to depress the activity of locus coeruleus neurons. So that concludes our lecture on the adrenergic alpha agonists, both alpha 1 and alpha 2 receptor agonists. So let us move on to our selective beta agonists. So head over to the next video on the playlist.